Welcome to the Multan Public School and College Multan. Good morning, good afternoon, good evening, good night, at whatever time you are preparing your lesson. Head ears, I'm Mr Naeem, your biology teacher. Today's learning objective are respiratory disorders, different kinds of, like emphysema, asthma, lung cancer, etc. and the bad effects of smoking, and at the end I would like to add notebook work to you. First, emphysema. Emphysema is a chronic disease that gradually destroys the lungs. This destruction means that you become unable to breathe in the enough oxygen. You also have trouble breathing out carbon dioxide. Emphysema literally means destruction of the wall of the alveolus. Is smoking. It is the most preventable cause. Other risk factors include air pollution, heredity, and age as well. Smoking is the main cause of this disease, which destroys the lung tissues and it causes obstruction in breathing. It also causes inflammation and irritation of the airways that cause this disease, and it becomes worse. Today's second respiratory disorder is pneumonia. It is caused due to round bacteria, which is called Diplococcus pneumonia. Its definition is the inflammation or infection of the alveoli in the lungs. Its symptoms are fever, bluish skin, difficulty in breathing, increased pulse rate, mucus, cough, and mental confusion. What is meant by double pneumonia? Double pneumonia means when both the lungs are infected, and then there is a treatment of pneumonia. It is mostly treated by giving the antibiotics, mainly based on your health and the seriousness of the pneumonia and how old you are. The most common antibiotics given nowadays is amoxicillin, and then if the pneumonia is not bad, the infection can be treated at home. Secondly, one should drink a lot of the fluid as well. The cause of pneumonia are Streptococcus pneumonia, a type of bacterium, the chemical irritants, the viruses, or some other things. Pneumonia causes the alveolus in the lungs to fill up with the pus or the liquid, and that causes difficulty in breathing. The cause of pneumonia are Streptococcus pneumonia, a type of bacterium, the chemical irritants, the viruses, or some other things. Pneumonia causes the alveolus in the lungs to fill up with the pus or the liquid, and that causes difficulty in breathing. Asthma is a chronic lung disease, and it causes obstruction in the airflow. This obstruction is reversible. Asthma involve difficulty in breathing due to three reasons: the inflammation or swelling of the lungs, mucus in the airways, and tightening of the muscle. The symptoms of asthma are coughing, wheezing sound or a whistling sound, shortness of the breath, the chest tightness, sneezing and running nose, itchy and irritated eyes, inflamed eyes, in which water flows out of the eyes. Treatment. Asthma cannot be cured, but it can be controlled by avoiding the trigger or reducing the exposure to the trigger, the long-term use of the drugs that reduce the inflammation and the constriction of the air muscles. We can also control asthma by giving the relief drugs. For example, some people take inhalers, but one should not be dependent on them. And its symptoms. Lung cancer mean when the cells of the lungs start dividing uncontrolled and they cause some tumor in the lungs. The symptoms are fatigue, cough, shortness of the breath, chest pain, the loss of appetite, coughing up to sphagnum, and the hemoptysis, in which the cough comes up with the blood. The cancer spreads by different things and it shows different symptoms like bone pain, difficulty in breathing, abdominal pain, headache, weakness, and confusion. Lung cancer treatment is done on the basis of stages and the type of lung cancer. It can be surgery, removal of some part of the lungs, or radiation therapy, chemotherapy in which certain drugs are added in the body, or combination of drugs, the targeted therapy, and the lung cancer is usually treated with the combination of therapies. Of the smoking. Smoking affects the person from head to the toe. It is due to certain chemical present in the cigarette smoke. The major factors are, number one, cancer. We have discussed it in the form of lung cancer. It can damage the air passageways by inflammation, or even the voice box may be damaged. It affects the circulatory system, in which there is a clogging in the blood vessels, can damage the valves in the heart, the muscles of the heart, and there is a greater risk of developing infection in the person who is smoking. He has greater chance of risks, and he develops infection again and again. The weakening and the staining of the teeth. Dear student, this is the end of today's topic and as well as the chapter. Next time we will be discussing the new chapter. Now I would like to give you some notebook with task. Please write down the effects of smoking and then the definition of each type of respiratory disorder. Thank you.